Hi there. Hello, Mr. Mayorov.
Hello.
Would you tell us how the treatment efficiency of diabetes mellitus can be assessed?
Nowadays, fortunately, the efficiency of treatment for diabetes can be assessed first of all by testing blood glucose levels or sugar levels, to use an old-school term. With the advent of portable glucometers, this test has become our daily routine, and all patients test their glucose levels and try to achieve the target blood glucose levels recommended by their doctor. To this end, they have to test their glucose levels at different times of the day. Not only the fasting glucose level, like it was previously when a person had to visit a lab for the test. Now the glucose level is tested 2 hours after meals and before going to bed. Sometimes, to assess the long-acting insulin, a person must check their glucose levels at night at 3 a.m. and so on. But the final conclusion on the efficiency of treatment for diabetes on the correctness of all insulin dosages may be drawn based on the glycated hemoglobin level.
Hemoglobin is the stuff that carries oxygen in blood.
Indeed, since childhood, everybody knows that there's a substance in our blood called hemoglobin. It is located in red blood cells, RBCs, and its main task is to carry oxygen to body tissues. It is regular hemoglobin tested in the complete blood count. It is constantly binding to blood glucose in all people, not only in diabetes patients. Healthy people also have a certain amount of glucose in their blood, so it also binds to hemoglobin. This particular combination of glucose with hemoglobin is called glycated hemoglobin and is also designated with the acronym HbA1c. Why does this parameter help to assess the treatment efficiency? You know, the bonds in this conjugation of glucose and hemoglobin are very strong. Once glucose has bound to hemoglobin, it stays bound, up to the death of the blood cell. The lifespan of a red blood cell is about 3 months. It is a very useful parameter both for doctors and diabetes patients. The glycated hemoglobin level in fact indicates, but is not equal to. You should understand it. Just look at the table. You see the glycated hemoglobin value, for instance, 7%. It is often recommended to have glucose levels at less than 7%. The average glucose level of that is 8.6. They're not equal. Sometimes people say, glycated hemoglobin, it is the average blood sugar level, right? No, this is a parameter that indicates the average blood glucose level over 3 months, but it's not equal to its value. If a person wants to convert the glycated hemoglobin levels from percentage into regular millimoles or regular glucose level, they should use this table that can easily be found online. You can't, it's impossible to get prepared for the glycated hemoglobin test. Previously, people, when getting their blood glucose level tested in the lab, very often, many elderly people with diabetes do the following. They stick to the diet, they take their anti-hyperglycemic tablets and insulin in due time, and they demonstrate a normal fasting blood glucose level. Then they switch back to their regular lifestyle, they live with high blood glucose levels, and nobody knows it. It's a kind of self-delusion. You can't deceive the glycated hemoglobin. If you want it to be within the target range, you should live with this target glucose range for 3 months. Then it will be normal.
Well, you said we can't deceive it, but let's imagine there is a blood transfusion for some medical reason. In this case, will the glycated hemoglobin level change?
It is an extraordinary scenario. But technically you're right. We will dilute blood of a person with diabetes with a healthy person's blood with the normal blood glucose level and normal glycated hemoglobin level. And if this person with diabetes lived with their blood glucose outside the target limits and had high blood glucose and glycated hemoglobin levels, then after this dilution with normal blood, we will obtain temporarily a low glycated hemoglobin level that does not indicate the 3 months glucose level. But if a person continues to live with high glucose levels, their initial values will return within 2 months, and they will again have high glycated hemoglobin in line with their blood glucose values.
I see. And if the hemoglobin level is low due to anemia, does it affect the glycated hemoglobin?
You know, besides such an exotic procedure as blood transfusion, there may be other factors that may artificially either increase or decrease the glycated hemoglobin level, and doctors must know them and decide on a course of action in such cases. In particular, anemia is one of these factors, one of these cases. If a person has severe anemia, their glycated hemoglobin may not correspond to their 3 months blood glucose level. In these cases, another parameter should be tested. It is not as well known in this country, but if it's necessary in difficult situations, when the glycated hemoglobin level may be affected by some factors, these so-called fructosamines may be tested. It is a different compound, which is located outside the red blood cells, and therefore does not depend on anemia or other factors.
Thank you very much, Mr. Mayorov. Now I know how to assess the diabetes treatment deficiency and that glycated hemoglobin levels differ from average blood glucose levels.